We are now going to perform a simulation on a major trauma patient with a possible unstable pelvis. We are going to attempt to stabilize the pelvis using the SAM pelvic sling 2. First thing to note about the device is that the instructions are written very clearly right on the front. Next, we are going to expose the patient appropriately and remove any items that might be in the pockets. After lining up the splint, we are now very gently going to lift up at the pelvis just enough so we can slide the splint right underneath and center it around the patient's body. We also want the middle of the splint to line up with the patient's greater trochanter.
You may have previously been taught that sacral rocking is a way to assess an unstable pelvis. However, best practices now show that you should apply the sling based on mechanism of injury.
Okay, we are now going to fold up the splint and feed the strap right through the slot, and one person will pull the strap, the other will pull on the other strap until you hear a click, and continue to attach the Velcro. If you hear a second click upon releasing tension, that's okay too. Just continue to strap this right down into the Velcro. Another device you can use to stabilize the pelvis is called a T-pod. First thing to note is that the instructions are clearly written right on the packaging. Next, we have exposed the patient appropriately and removed any items from the pockets. We are now going to lay the splint on the ground with the side of the collar down and very gently lift the pelvis just off the ground enough that we can feed the splint through and approximately center it on the patient's body.
Next, we want to bring the fabric over to the center. The manufacturer suggests that you can cut this to the appropriate length. However, in the interest of time, you can just fold them down and have them meet again in the center. And then the next step would be applying the pulley system.
The pulley system applies with a simple Velcro, and we now pull until we feel the pelvis stabilize and attaches right around the clip to the other side where it again attaches with the Velcro.
Be familiar with the device used in your agency. Would you have applied either device differently or made suggestions to this crew? Apply the device in every situation of major trauma in which you suspect that an unstable pelvis might be present. Rely only on your clinical suspicion and do not base the decision on the examination of the pelvis. Place the device low on the hips, across the trochanters, and make sure that there is nothing in the patient's pockets to cause pressure points or other injury under the device.
The techniques described in this video are included to spark discussion, not as authoritative practice directives. Consider the benefits and limitations of each technique and discuss with your colleagues and medical director. The content is intended as an educational resource only and not intended to supersede any state, regional, or local guidelines, protocols, policies, medical direction, or any other authority.